So good day everyone. Today's webinar aims to increase awareness and understanding about human immunodeficiency virus or HIV. HIV remains an important public health concern not only for medical professionals but also for nurses too and other people who have been impacted by this disease. But through proper education, prevention, early testing, and proper treatment, people living with HIV or PLHIV can live long and healthy lives. Um, this webinar will discuss about the what is HIV, the complications of HIV like AIDS, and of course the treatment and how to test, and of course the nursing responsibilities and the diagnostic procedures and the of course, the therapeutic assessment of on how we can alleviate the patients living with HIV. So next slide, please. So what is HIV? So HIV, or from the word itself, human immunodeficiency virus, is a virus that attacks the body's immune system, particularly the CD4 cells or T helper cells. So which help in the immune response of our body in terms of arriving infections or arriving diseases that can impact or in simple terms pathogens that can harm our body by multiplying themselves. So HIV attaches itself to the immune system, which in turns weakens it because instead of replicating the adequate number of immune cells, it replicates HIV RNAs in and of itself. So we can discuss that later. When left untreated, HIV weakens the immune system and may progress to specific complications like AIDS, which we will discuss later. So it can spread to certain bodily fluids. For example, through vaginal um, fluids, through blood, of course, to breast milk, through rectal fluids, and semen and other types of fluids except saliva. So this is a common misconception between people that HIV can pass through saliva, which is not the case, or even sweat. It needs to be secreted by either the genital area or any part that is internal, like your blood or your breast milk. In terms of sweats and saliva, it cannot spread through that way. So next slide, please. So what is AIDS? So some of us use the two terms interchangeably. So we use HIV in some terms and use AIDS in some terms. So that is not the case. HIV is the um, HIV is the virus in itself that we acquire through the specific transmission, while AIDS is a stage of HIV or a disease itself that HIV causes in our body. So what is AIDS? AIDS is acquired immunodeficiency syndrome. This is the most advanced stage of HIV. Occurs when the immune system is severely damaged. Without treatment, HIV can progress to AIDS. So let's think of HIV as a specific pathogen. So when a pathogen arrives in our body in its new state, it first and foremost is what do we call this? It's in its incubatory phase, or it is latent, or it cannot cause any huge harm if it is in its new state. So when HIV is left untreated, it can progress to AIDS or acquired immunodeficiency syndrome. So in acquired immunodeficiency syndrome, your body is extremely weakened because many HIV cells have replicated itself, and in turn, specific immune cells like your CD4 or your T helper cells are extremely lowered. So in this instance, AIDS is of course a late stage. So when we say late stage, this is where most illnesses come out. So HIV does not cause any particular symptoms in and of itself. So that's why it's very difficult to diagnose or even suspect if you're having HIV because it can be a sign of only a weak immune system or either a strong pathogen. So that's why HIV or AIDS is HIV is extremely difficult to detect in clinical diagnostics. But when it progresses to AIDS, we can acquire specific symptoms that can the specific pathogens or specific diseases that can simply be mitigated by a normal immune system. So what are examples of diseases that we can acquire during AIDS? So some of these are, for example, tuberculosis. Some of these are the uh, the return of shingles or other um, simple diseases that can be alleviated by specific um, immune system response. So next slide, please. So as said earlier, HIV spreads through specific body fluids only, like our blood, semen, vaginal fluids, rectal fluids, and breast milk. So it cannot spread to sweat, tears, or even saliva. So it can be passed to unprotected sexual contact without the use of any protection like condoms or vaginal diaphragms. Next is sharing needles or syringes. So HIV can also be acquired without sexual contact. Let's say, for example, a needle prick injury that a healthcare worker has acquired during their duration in the specific facility, and of course from mother to child during pregnancy, birth, or breastfeeding. However, in the mother to child transmission, if the mother has HIV and they take the therapy or the treatment um, for the specific disease, for the specific virus like HIV, sometimes it cannot pass to the children if the drug is taken religiously. And of course, the child is immediately given post-exposure prophylaxis during birth. So next is the true contaminated blood transfusions. So although rare, because today we screen specific blood types or specific blood samples that we receive during blood donations. So this is a rigorous step-by-step process in which we check for the patency of the specific blood and to ensure that no diseases like HIV can be passed through the specific patient. So next slide, please. So next slide. Some people have their own specific religious beliefs or sometimes misconceptions or sometimes misinformation about how HIV spreads. But HIV cannot spread through hugging or touching, sweating or tears, mosquito bites, sharing food or drinks, or using the same toilet. Because when you put the HIV virus in vitro or outside the specific host, it cannot live that long because it's a virus. So specifically, it's not a pathogen like a bacteria that can live outside the body for too long. However, because of its limited capacity to live outside the body, it cannot spread through even using um, the same toilet or through mosquito bites or hugging or touching because from the word human itself, it cannot use mosquitoes as vectors of transmission. This is not like dengue or Zika virus, which can be used through the transmission of mosquitoes. But in this case, thankfully, HIV cannot spread through the same vectors as mosquitoes. So what are the signs and symptoms of HIV? The early signs often resemble common flu or viral infections, like fever, one of the most common early symptoms, skin rash, extreme fatigue, sore throat, and mouth ulcers. So you must remember that HIV does not cause a specific symptom in and of itself. You can present with HIV and be positive for it, but you are considered asymptomatic if you do not experience the same um, specific uh, symptoms. Because HIV weakens the immune system, we only get diseases or pathogens if, for example, opportunistic infections happen. So what are types of opportunistic infections? When we receive chickenpox during our childhood, it does not, in some cases or in most cases, it does not simply subside by itself or be extremely um, excreted from the body. Some chickenpox viruses still remain in your cells. So when you have HIV and your immune system is weakened, it can be a cause for chickenpox symptoms to be or shingles to come out. That causes skin rash, sore throat, and mouth ulcers. This is the most common symptoms because why? Because your mouth or your tonsils or upper respiratory tract is often contacted by numerous pathogens throughout the day, throughout your whole life even. And when your immune system is weakened, it gives way to opportunistic pathogens like Staphylococcus aureus or other group A or group B Staph aureus. or other specific bacteria, fungi, or viruses that may um, come into contact with you. So that's why even the common flu for those people living with advanced HIV can be deadly because your immune system does not have the capacity to battle the specific disease. So moving on, testing and diagnosis. So HIV tests are simple, safe, and confidential. Early detection allows early treatment. Testing options, your rapid test, your antibody test, or your self-test. So most HIV testing facilities are present. Let's say, for example, in Zamboanga City, in all major general hospitals, there are HIV tests that are available for everyone um, to use or to avail of. It allows for early detection because, for example, if you're positive with HIV much more earlier, and you can begin the treatment with antiretroviral viral therapy much more earlier, it can alleviate specific symptoms. Or you can live even a normal life if you take antiretroviral therapy much more earlier. So testing options, your rapid test, your antibody test, or self-test. The rapid test tests for a specific plasma found in your blood. So when you are positive in your rapid test, you can move on to the next antibody test. But the problem is in the rapid test, it is only evident maybe 60 to 90 days, while your antibody test is strictly 90 days because you need to be positive for a long time before you test positive for any antibodies. So that's why the the detection period for HIV is sometimes extremely long. It can take to 3 months to test positive because if you have sexual contact the week this today, you will not immediately test positive the week after. It takes some time, like a month, 2 months, or 3 months. And of course, the self-tests which are available online. However, the DOH has released memorandums warning against specific self-tests because sometimes they can be inaccurate. So sometimes we need to ensure that the self-test that you buy online is FDA approved and of course has been proven and tested by different clinicians or specialists. Next is HIV treatment or the antiretroviral therapy. So ART is a standard effective treatment for people living with HIV. It works by stopping the virus from multiplying in the body. So in HIV treatment, we often utilize the reverse transcriptase medication. So what is reverse transcriptase medication? Because HIV is an RNA to DNA virus, it hijacks the immune cells by transmitting its own data to to the RNA, to the nucleus of the cell in order for the cell to develop the DNA or the RNA samples of HIV. So that's why it's so difficult to be cured of because first and foremost, HIV replicates itself numerous times that it can even be counted. So that's why in assessing for the stage of HIV, we only count the CD4 cells. So the CD4 cells are the immune cells on which HIV attaches itself on. So if you have lowered CD4 count, therefore you have high HIV levels um, in your body. But if you have high CD4 count, so HIV is only sleeping in your cells. So that's why we test for CD4 count or the T helper cell count in order to assess for the stages of HIV. So if we take the antiretroviral therapy, we in turn stop the replication of HIV in our cells. So that's why when people living with HIV take antiretroviral therapy religiously, their CD4 count is high and the HIV virus is only sleeping or is only latent in their own body. However, if you don't take the medication, if you don't take antiretroviral therapy, it in turn causes HIV to replicate itself numerous times, leading to lower CD4 count, meaning a weaker immune system and the possible development of acquired immune deficiency syndrome. So it must be taken daily. This is OD. So skipping doses is not an option here because it is akin to not taking the medication itself. So viral load again is detected through your CD4 count or immune cell count, and treatment plans are personalized by healthcare professionals. So if you have HIV, it's much better to go directly to a health professional in order to be prescribed with an antiretroviral therapy. People living with HIV and who take part often live a very long and prosperous life as if they do not have HIV in and of itself. The next prevention methods, of course, let's practice safe sex as accorded to us by the RH bill, and do not share needles. This sharing of needles is not anymore practiced in our clinical profession because we utilize one needle per injection. So we do not share needles anymore. However, the practice of sharing needles is common in people in the underground because, for example, in the sharing of injectable drugs, illegal drugs, and of course, other um, practices that might warrant the use of needles. Next is consider PrEP or the pre-exposure prophylaxis for high-risk individuals. Let's say, for example, with our sex workers or those who engage themselves in the activity um, of doing work for sex work for money, they need to consider PrEP in addition to their use of safe sex methods like condoms and diaphragms. So next is treat HIV positive mothers to prevent transmission. As I said earlier, when the mother takes antiretroviral therapy, they have a very, very, very low chance of inheriting the specific disease to their children. Next is the
One cut lang, sorry.
responsibilities of the nurse. Um, First, we provide health education. Next, provide emotional support and ensuring proper care and treatment. Practicing infection control and advocating for patients' rights. As nurses, most HIV counselors are nurses because they can provide medical advice and of course are practiced in ensuring that the patient's rights and the patient's care remain the top priority. So one of the most important obligations that we have as nurses is we advocate for the patient's rights. PL-HIVs are most vulnerable to stigma, and of course, with um, instances where their rights are squandered because of their disease, maybe due to due to religious reasons or personal reasons, our fear is most prevalent in handling patients with HIV. So that's why as nurses, it is important that we advocate for their rights as specific individuals, as dignified human beings, and we must provide first and foremost um, proper care and treatment, and of course, emotional support. Practicing infection control, of course, is required as a nurse because we are in charge of maintaining infectious control procedures in our workplace. So, for example, if you have a patient living with HIV, we must ensure that there are no fluids that are shared, their needles are properly disposed of, and of course, patient education is important because in order to minimize the transmission. So for the next slide, I'm going to pass through it to my partner. Hello?
Okay, so one of the biggest challenges faced by people living with HIV is stigma and discrimination. So many individuals are afraid to get tested or seek treatment because they fear judgment from others. And then, so sadly, this stigma can negatively affect mental health and overall well being. So, people living with HIV deserve respect, empathy, kindness, and support just like everyone else. So, awareness and education help create more inclusive and understanding communities. So, when we learn the facts about HIV, we become more compassionate and less judgmental. So, ending stigma starts with the words we use, the way we treat others, and our willingness to educate ourselves. So, next slide, please. Next slide po. So, being diagnosed with HIV does not mean life is over. With early testing, proper treatment, and continuous support, people living with HIV can still live full, meaningful, and productive lives. So they can work and build successful careers. They can continue studying and pursue their dreams, and They can also have healthy families and relationships. And most importantly, proper treatment and support are the key. Antiretroviral therapy, as mentioned a while ago, or ART, helps control the virus and keeps the immune system strong. And aside from medicine, emotional support from family, friends, and the community also plays a very important role. And so, next slide, please. So, millions of people worldwide are living with HIV today. Despite the progress in medicine and treatment, HIV continues to affect many lives or many individuals and families. However, many cases can still be prevented through proper awareness, education, and safe practices. So early testing is also very important because it helps people know their condition sooner and receive treatment immediately. With early treatment, people living with HIV can live healthier and longer lives. So, locally, HIV cases continue to increase, especially among young people. This is why spreading correct information and removing misinformation are very important. So, next slide. So, now let us discuss the role of nursing informatics in the HIV care. So, first, it improves patient record management. So first, it improves patient record management. So electronic health records help workers organize patient information safely and accurately. Second is to supporting medication adherence. So it support technologies such as reminders, apps, and monitoring systems help patients remember to take their medicines on time. Then third is enhancing patient education and awareness. So online resources, webinars, and digital materials allow patients to access reliable information about HIV. And the fourth, improving communication and access to care. So it improves communications and access to care because telehealth and online consultations help patients connect with healthcare providers more easily. And lastly, promoting confidentiality and patient safety. So, patient information is protected through secure systems, helping reduce fear and discrimination. So, we should always remember that HIV is a health condition, not a reason to discriminate against someone. So, with proper education, early testing, treatment, and community support, people living with HIV can continue living healthy and productive lives. So, together, we can spread awareness, fight misinformation, and help end HIV stigma. JM.
Thank you for that. Together, we can end HIV stigma. So my group is um, thankful for those who listen to this webinar, and we hope that through proper knowledge and to proper um, health education or patient education, we can disseminate that people living with HIV can, of course, live normal lives if they are treated well or with proper treatment. And of course, we can do preventative management in order to end the disease because HIV is not a pandemic. It's not an epidemic. It is a pandemic that can be resolved unless a cure can be found. Of course, looking for a cure with HIV is very difficult, mainly because this is a virus and it can replicate very quickly. And this has been since the 1980s. And of course, we pray and we hope that the specific cure for this evil disease can be sought after or looked for in order to help those who suffer from this disease. So with that, we end the presentation on human immunodeficiency virus, and um, uh, of course, its complications like AIDS. So, of course, let us continue to advocate for knowledge, understanding, and respect for all when it comes to the topic of HIV. Thank you, everyone, and